Hello everyone. In the previous video, we talked about the results of Israel data on the fourth dose of the Pfizer vaccine, and we showed that the protection of a fourth dose is for infection is very short-lived, at about a month, and the absolute reduction in severe disease is pretty low as well, although that is seemed to be continuing throughout their trial period, which was about 7 to 8 weeks in length. But what's important is that repeating the vaccine using a wild type vaccine that was based on the virus from 2 years ago, when the virus has mutated multiple times since then, doesn't seem to be a very good method. And it's pretty clear that we need to get vaccines that address the current variants that are circulating in the world now if a vaccine is going to be more effective than just giving the same vaccine over and over again. Because of that, the NIH is starting a trial, and people can sign up if they like. And this is the link to sign up for the trial if you would like to do that. And basically, this is called the COVAIL trial, known as the COVID-19 Variant Immunologic Landscape Trial. It's sponsored by the NIH through the National Institute of Allergy and Infectious Disease. And what they are doing is, in conjunction with Moderna, they're going to try a dose of a booster of the regular. This is the regular vaccine that everyone's gotten. This is a one. So there's 6 different arms. One, you get the regular vaccine. The other arm, you get one that has a mix of an anti-beta and an anti-Omicron. And then another one, which is the anti-beta and anti-Omicron, but separated apart with 2 separate injections. And then this is against Delta and Omicron, and one is just Omicron. And then one which is an injection that mixes the original vaccine with the Omicron vaccine. So they're trying to see if you give it, I think the holy grail now of a vaccination schedule would be to get a multivalent. So that means one vaccine that has several different variants of the spike protein, so that it covers many different types. And so theoretically, if you get enough different variations within one, it may give your immune system a good enough look at it to be able to fight off even future variants, because it's seen enough variants of it. And so they're hoping that some mix of this will give people long-lasting and robust protection against even future variants. And it's a very interesting study, and I'm glad that they're doing it. Hopefully, the flip side of this is that a lot of people have now been vaccinated with the wild type and gotten Omicron. That would be my case. And so, in essence, those people probably have very good immunity. They've had, their immune system has had a look at the original virus through the vaccine, and now they've also had a look at the most recent variant, which is Omicron. Of course, there's like BA2 and other things now, but your immune system has gotten a look at 2 different, pretty different variants of COVID, and so it's almost like you've gotten one of these super vaccinations. But for those that haven't, these may be a good technique. And so those of you that are interested in signing up for one of these trials, I think that this is probably a superior thing than getting boosted with with just another shot of the original vaccine. So you can go here, and it will give you information about the COVAIL trial and how to sign up.